Hi,
Okay.
everyone. Hi, everyone. I'm calling the advisory committee meeting to order at 7:33 p.m. on February 2nd, 2022. We have 6 out of 7 members from advisory here. Eric Fernandez is, and I'm using his word, stuck in the Dominican Republic. So I'm sure will be back next meeting. So we've got everybody here but Eric. So we're going to get started quickly in order to take advantage of the fact that we've got the entire Board of Health ready to go and don't want to waste their time. So we'll do the minutes afterwards like we did last week. I do want to do the chair report real quick. It's quick because Chelsea's here in case she's got anything to add, given she's got a lot more inside info as far as what's going on with town meeting, et cetera. So let's get this out of the way. Okay, so here's the update on town.
Kathy, hold on. Chelsea just has to call her meeting to order.
Sorry, Chelsea.
Thank you. So I called the Southborough Board of Health meeting to order at 7:34 p.m. on February 2nd, 2022, and all board members are present. And we also have Public Health Nurse Taylor West and Public Health Director Dr. Heather Elker here with us tonight. Thank you.
So welcome, everyone. Okay, I talked to Chelsea today, so I think this is the latest update on the date and time of the annual town meeting. So at this point, you may remember that at the special town meeting on November 1st, one of the articles that Jim Haggerty had sponsored was to basically allow us to have the annual town meeting outside Southborough. And of course, what he was thinking at that point is the Algonquin Auditorium, which is much bigger than our Trotter Auditorium. So that passed. And just like our advisory bylaw change that passed that night, we're waiting for the AG to officially approve those, which no one expects there to be an issue. They've got 90 days from the date that it was submitted to them. He submitted around November 15th, so he thinks their date is February 15th. So it's coming up to approve both things. So the thinking is right now that it will be an indoor meeting at Algonquin. So they have asked the school to basically provide dates that we could have that we knew we could have it for 2 nights in a row. So instead of a Saturday outdoor meeting like we've had the last 2, it would be a possibly Monday, Tuesday indoor meeting. So more to come, but the range of dates is still around April 30th to May 21st. So Chelsea, if I say anything wrong, just raise your hand. Okay, I'll assume you agree unless you raise your hand. So that's what we stand right now. So we still got to block off that time period and they will let us know as soon as they know. So maybe we've got to wait to after February 15th to know that we've got Algonquin legally usable and we know what the Algonquin dates are. And then the select board meets, which would be on the 15th to decide the date. So hopefully on the 15th, they can actually that night pin this down and let us know the details. Okay, so there's that. The 2, remember, we're not meeting as a committee next Wednesday because the school committee is meeting and the capital planning committee, school research subcommittee is going to be presenting their report to the committee. So that's going to basically wrap up the work of that subcommittee. And it was charged, as you remember, we've talked about this many times, to determine whether we think the demographics of Southborough would allow us to close one of the 4 K-8 schools in Southborough. And so I've kind of spilled the beans and said, yes, we will conclude that you can. You guys probably followed some of that. So hope you guys can come. I will post a meeting in case we have a quorum. So that way, if you want to talk, discuss things, whatever, you can legally do that. So that's next Wednesday. And I actually don't know what time it starts. Chelsea, do you?
I think they start at 6:30.
Right.
Is that right? For school K-8 school committee usually.
That sounds right. So anyway, it's going to be posted. So take a look at that and hopefully you guys can come to that. Anyway, that's kind of a big deal. We've got another potential reserve fund transfer. And remember, we've asked whoever has the transfer, the need, to let us know ASAP that if they wait till the end of the year and we don't hear about it, then we won't consider it. And Chief Achilles has done exactly what we asked him to do. So this is a fire department request. It could be as much as 10,000. We won't know until the end of the year when we actually see how their budget ends up. But they have got a potential, or they are promoting a gentleman to lieutenant. and he's got to do his exam and assessment process, and it could be up to $10,000, depends on how many days it is. So Chief Gillies has written us a letter and basically said, FYI, please be aware that there may be a request at the end of this fiscal year to do that. It just depends on how his overall budget turns out. Okay, I think that's it for, yeah, so that's it for my chair report. Okay, so let's jump right into Board of Health. So Chelsea, why don't you introduce everybody that's here to advisory, and then we'll go from there.
Okay, thank you. And thank you for having us. And I'm just going to briefly introduce the board member. So Dr. Safdar Medina is with us tonight. He's the newest member to the Board of Health, joining at the beginning of September. He has a wide breadth of knowledge in terms of the school side of Southborough from a medical perspective. He's a pediatrician and has brought a lot of value to the board. Dr. Medina, do you want to say a few words?
No, thank you all for having us today. Thanks for the introduction, Chelsea. I'm, hoping that we move our Board of Health forward with the vision that we have.
Thank you. And Nancy Sacco is also on. She's the longest tenured member of the Board of Health and provides another great background. She's a nurse and has a great perspective from kind of the hospital side of the world that we're living in. Nancy, do you want to add anything?
No, thanks for the introduction. I think I know a few of you anyways from over the years, so hello.
Okay, great. Thank you. And then Dr. Heather Elker has been our public health director since January of 21, December of 20.
A year. No, it's basically a year.
Okay, but you've been with, okay, so she was with us for a few months prior, kind of on an interim basis to kind of help us get through the pandemic.
Right, it was the interim, like January to June and then July. Yeah, but
yeah.
Total, it's been a year.
Yeah, and her knowledge and expertise has really helped us to kind of make sure that Southborough is at the forefront of, getting vaccines to our residents, making sure we're following all protocols available to respond as the public and businesses need, working on making sure we provide any resources needed to get our inspections up to speed. So she's that's kind of her background. She also has a significant background on the medical side in a lot of different areas. And then our public health nurse is Taylor West. She's been with us since April of 21. And she has also a large background in terms of nursing. This is her first public health job, but I think she's gotten her feet wet pretty quickly, and also has been a great resource for the residents of Southborough, as well as done a lot of collaboration with our boroughs group in terms of shared service grant and working together to collaborate on how we can maximize on public health resources for the communities that we live in.
So advisory, this is basically the entire staff for the health department and the entire board, with the exception of the administrative assistant or business administrator for the Board of Health, which is Barbara Speary, who is, as we heard from a meeting with Paul Sabelli a couple of weeks ago, she is shared between the assessor's office and between the Board of Health. She literally physically goes back and forth between townhouse and the Court of a Hall building. So she's the only person that's missing tonight. So, all right. So let's just tell Chelsea, I think we need to tee this up because we've got, 3 new advisory members here tonight that weren't part of the lengthy discussion we had on this budget last year. So I think it would help to kind of start off with background.
Sure.
Anyone that wants to supplement what I'm going to say, please just raise your hand. Okay, so last year, the Board of Health came forward. Now the Board of Health last year was, Chelsea was not on it. Another person named Mary Lou Woodford was the chair. Mary Lou moved out of town at the end of the fiscal year, and so therefore had resigned from the board. Chelsea ran for Board of Health and won in an overwhelming election. So there she is. So Chelsea's kind of gotten thrown into this budget discussion in the middle of it. So it started last year. This is absolutely continuing. So Heather was part of it, so she's well aware of the discussion. Nancy was part of it. And Taylor, you were probably at least part of some of it. And Dr. Medina, you came at the very tail end, so you really weren't part of what led up to town meeting. So, but I'm sure you're up to speed, but just to kind of set the background. Okay, so last year, the discussion was the Board of Health felt like we needed to really change the structure of the health department substantially, and one that will result in a very, very large year-over-year increase to their budget. They wanted to go from basically a part-time director to a full-time director. They had a nurse whose time was shared with council and agent, as we heard, Leslie Chamberlain. Leslie decided she wanted to work less hours and basically retired from the Board of Health position to work solely for the senior center. So she's still there, but only as a senior center part-time nurse. So they wanted to hire a full-time nurse to replace Leslie's part-time hours. They also wanted to change Barbara Sperry from part-time shared to full-time with the Board of Health. In addition, they wanted to do something about making sure that they weren't going to violate HIPAA. So they wanted to buy a machine that would be just theirs, that would let them scan whatever in a way that would protect HIPAA information. So these are big, big changes. We normally don't see budgets that ask for that kind of change in 1 year. It was quite substantial. Most of the time when budgets are changed, they're changed a little bit at a time, over time, so that the impact is not so drastic 1 year. So we probably spent, I know Andrew, Tim, correct me if you disagree with this, we probably spent more time on this relatively small budget than we did any other budget last year in town, just because it took a long time to get to the point that we could agree to what we would go forward with at town meeting. So we came up with a compromise that basically probably kicked the can down the road, which is why we're here tonight. It allowed for the 2 full-time people that are here tonight to be employed with a year contract that started July 1st, 21, goes to 6/30/22. The admin position stayed 24 hours for Board of Health and 16 for assessor, so that did not change. There was an agreement, though, that didn't really get honored, that whatever the Board of Health needed, they could use. So, and that didn't happen, but I'm not going to go back to that tonight. I don't think we need to do that one. I think that was kind of settled. That's the one thing that's probably settled tonight, is that's not being asked for. So that's what we did. And the way we did it is we did not increase the budget for fiscal year 22 by anything substantial. We knew that we had CARES Act and or FEMA funding for at least the first 6 months of the fiscal year. So we knew that if we didn't put the salaries of the 2 full-time people into the budget, we would be eligible for reimbursement from one of those 2 programs. If it were in the budget, we would not be eligible. So it was a way to receive the funding from either the CARES Act and or FEMA to at least fund the cost of the additional salary costs. So the what was in the budget was from the previous year. So that we'd pay for, right? The town would pay for with this budget. It was that increase that would be funded by outside sources. So that was going to take care of the first 6 months. And then advisory did something rather unusual. Advisory voted to then backstop the next 6 months of that additional cost using the reserve fund. So again, it wouldn't be put into the official budget for 1/1/22 through 6/30/22. Whatever the additional cost was, if there were no new government fundings, no new anything that would pay for it, then advisory has basically said, we'll use reserve fund to pay for it. But again, it would keep it out of the budget so that we would have a chance to get funding if the funding had been extended beyond 12/31/21. As far as I know, the CARES Act funding has not been extended. However, FEMA is going to go through April. So currently, at least Taylor and possibly Heather, so correct me, Chelsea, if I'm wrong here, is still keeping track of the hours that she spends that are pandemic related And she submits those to our town accountant, who then submits those for reimbursement. So the reserve fund is still probably going to be used to some extent for 6/30/22, but probably not as much as we had originally anticipated. So I'm going to stop there and see if anybody disagrees with anything I just said or wants to amplify what I just said, because it's really important everybody understands what I just said, which is why you're seeing such a big proposed increase from 22 to 23, even though these two ladies are working full time for fiscal year 22. Chelsea, you want to add anything to that?
The only thing I think I'd like to add is, I think through FY22, it's been extremely important that we have staff in Southborough through what we are dealing with right now. I don't think any of us sitting here a year ago would think that we would still be in this position. And I know Heather and Taylor are prepared to kind of give you a high level overview of what their breakdown of time is between, COVID dedicated time and non-COVID time during kind of surge periods and non-surge periods, to kind of give you a sense of how much time they're spending on this. So I just want to echo that. I think, getting these two positions for FY22 was extremely helpful for the department, and kind of for getting us to where we are in terms of public health in Southborough.
So I'm glad you added that. Advisory never questioned the need for lack of a better word, surge protection here as far as that goes. We knew that there were services needed that we didn't normally need because of the pandemic. Our problem was trying to, if you remember in college when you learned discriminant analysis, trying to pull it apart and understand what the permanent structure of the Board of Health should look like post-pandemic. Now, of course, another year's passed, right? We thought we'd be in much better shape as far as the pandemic. You now hear that we may never be rid of COVID. Hopefully we'll get out of the pandemic, but we're just going to live with it for years. We got to live with it like we do other things. So I don't know where this goes. No one here knows where it goes, but we never disagreed that we didn't need extra help in time because of COVID. That was not an issue. So there's no even bother to try to convince us that we understood that. But what we didn't understand is what the department should look like post-pandemic. And that's what we were trying really hard to get to as far as that understanding. Then the state stepped in and started truly clearly supporting regionalization of boards of health. So that happened at the end of it too. They, as you know, we've got the grant, the $300,000 grant with the 4 towns. So they clearly are pushing toward towns looking at services on a regional basis to achieve economies of scale, to, when you don't need a full-time person, share it. So that's their push right now too. So that started happening too. So advisory simply wanted to make sure there was enough time to consider all of this so that we make a really good decision as far as what the structure of this department should look like going forward long time. We focused in the past on septics, right? Paul Pazinski was that was his area. So we had never focused on the things that are listed in this document you've given us. We had a much different focus. So we are all ears as far as trying to understand what we need going forward, but that's what we got to get to, is to understand that and to know that we are making a really honest effort to understand the pros and cons of regionalization, where it works, where it doesn't work, because it really seems like that's what the state wants us to do. That's I drive around listening to NPR. I hear people on NPR pushing the same thing. So we just need to get to the point that we really think we've got a good long-term plan, and then when we do, it gets funded. We're just trying not to lock ourselves into this until we know that we're there. So we're on your side. We are open ears. Do not think we are not going to listen to what you say we need, but we got to get to the point that we think we understand what it should look like based on models. If you add the 4 towns together, you got 50,000 people as far as what you're covering. We just want to do what we can to provide a budget that is fiscally responsible. It's what this town needs and wants, so that we've done our job. That's our job as an overall budget. It's not to tell the Board of Health, what to do at all. That's your job, is to tell this department what it needs to do and how to do it. We rely on your expertise. Our job is to provide a fiscally responsible budget to town meeting. That our job, we're a committee for the town meeting that makes sense, that hopefully doesn't makes real estate tax bills reasonable, but it provides the services this town wants and needs. So it's kind of simple as that. So with that, rather than to start picking on your budget, which everybody's seen, I think we've really got to just talk about big picture first, and then see where it goes. So we are not, Dr. Medina and Heather and Taylor, we're not going to make a decision tonight. Nancy, all we're doing is listening, like we have every other department. The town meeting's been pushed back again, some, so we've got a little bit extra time instead of having a March meeting. So we will not be voting on anything tonight. We really just want to listen. And my guess is we'll probably end up with another meeting with you before it's over with, when we've really had a chance to put everything together that we think is important. Okay. All right. So Chelsea, do you want to lead this part? Do you want somebody else to do it?
Yeah, no, I'm happy to. Thank you. So I just want to give a general overview of some of the initiatives that the department's undertaken in the last year. And because they're important to understand, because the staff that you're seeing on the screen tonight are the employees that are present in Southborough full-time. But in addition to that, we are supplemented with some grant funding through the shared service grant, and it's called the Greater Boroughs Partnership for Health. Heather, correct me if I'm wrong. I feel like I always mess those words up. But that is the 4 towns that Kathy's referring to. So we do get our food and housing inspections from that grant, and that has been an extremely important aspect to the Board of Health that I don't think was a big focus in prior years. So that was definitely an area that needed more support, and Heather participates in a lot of those discussions and keeping the board updated on the issues. And we have had issues that have been rectified, worked through, and the woman in Northborough who is spearheading that for us is absolutely phenomenal. And I think that the town of Southborough has been benefited tremendously just in that one facet of this shared service grant that we were awarded for the 4 towns. So I just want to point that out, that, even, the staff on the screen do a lot of the work, but we are benefiting from these other grants that we're getting. I mean, in addition to that, there are some software systems that we're getting from that, and also some nursing time for surge capacity. Southborough is the only one that actually has a full-time nurse on staff out of the 4 towns. So generally speaking, between Heather and Taylor's time, they're covering most of the inquiries and all the contact tracing that, during the surge. But we definitely have tapped into some of the nursing time as well. So that is the $300,000 grant that could last up to 12 years because there's a few renewal clauses in there. And that the fiscal agent of that is Northborough. So the employee that I referenced, her name is Diane Legier. She is a Northborough employee and is kind of, works into her schedule as best possible to get us up to speed. And she gives us a report every month on all of the food and housing. And I just want to point out that there's been some housing calls as well that she has been an integral part of. So that's one part. Another
And
part
she
is
is the Northborough director, health director?
no, she's a health
No.
agent.
Okay.
Yeah. So then there's also an additional grant that was acquired through FY23 that the Boroughs group was able to acquire more nursing time for surge capacity and some clinic work, as well as a 19.5-hour epidemiologist. So the epidemiologist started in January. She's currently a grad student and is actually helping with all the towns with their reporting dashboard, collecting information, providing support to our daycares and preschools in the 4 towns. There's definitely a large need to keep in touch with those groups because they're the ones that have the largest population of unvaccinated children at this time. So she's trying to kind of plug holes in terms of helping those get those questions answered and alleviate a little bit from the local boards of health from those questions and just trying to provide consistent information between the 4 towns.
How much is that grant, Chelsea?
Did I?
You didn't put that in your memo. That's why I'm
I didn't
asking.
put that amount.
No, that was my question at the end of that paragraph. How much is this one?
I don't know. If
It's a year and a half. I know that it started roughly in December and then it goes through
Yeah.
the next fiscal year as well. So it's basically a year and a half. For the 4
have to-
towns, it's the 19-hour epidemiologist, and it's also, I can't remember if it's a nurse and a half, maybe 2
Hold on, let me
nurses,
see if I
but
can-
split
Right, can we
between 4
just-
towns and the other
Let's
2
not waste it.
towns.
So we'll find out. Chelsea will get it to us.
Right.
Okay, so
Right.
Yeah,
keep
that's
And I
fine.
think you guys know with the shared service, I mean, the Westboro and Northborough are the bigger towns, so sort of per capita, they're going to see a little more of the hours, and the Boylston and Southborough are the 2 smaller towns.
well, Boylston's half of Southborough. Northborough's 50% bigger, and West.
Right.
So our original request for the grant was 345,000 and we got 320,000.
That's a good sized grant. Okay.
And then in addition to that, Heather applied for the Metrowest Foundation grant that was kind of a quick turnaround and awarded pretty quickly as well. So we actually got notification of that the end of last week. So it's not updated in the summary document that you have in front of you because I didn't know when I wrote the document. But that was for $50,000. And there's a few pieces of equipment in terms of iPads needed for vaccine clinics that we've kind of been, struggling with laptops that need to be continuously plugged in because they're old from the school department. And there's some other items that we've kind of floated ideas on how we can best use that grant funding, but that we should be getting, if we haven't gotten it yet, we should be getting it fairly soon. We're working on our public outreach. So that will be another thing that will probably come out of that pot, but that was a $50,000 grant that can be used essentially
Right,
on
and that's
anything COVID related.
COVID specific, right? So a lot of COVID testing supplies. There was a teeny bit about personnel because in the budget, we don't have overtime. We don't have per diems in our budget anymore. So there's a few small hours for that in there, but in general, it's sort of supplies for clinic and testing.
Didn't you have to list what you wanted to spend it on in the grant application?
We did, but if it's, we did fill that out.
But I think there's some flexibility if, some like, one
As
thing that
long
could
as
come
you
up.
stick within COVID.
Yeah. Like, we don't know, we may need to host some more clinics. And so there could be costs associated with it. Like, we just don't know what the kind of the playing field's going to look like for the under 5s, and what kind of per diems we would need to get to do that. And if that would be within the other grants for the SAM and BNA, or if we would need to kind of subsidize, or if FEMA's not going to cover it. So I think you do have some flexibility, but there's kind of a, we had to Heather did a nice job of categorizing all of the different areas that we could potentially hit on.
When does it have to be spent by?
I think it's like September 2021. It's sort of,
2022?
I'm sorry, it is already 2022, although, right, it's this year. Yeah.
Okay, so Chelsea, one tact as far as trying to fund these 2 positions full-time for fiscal year 23 without, again, locking in the budget permanently is to try to find ways to temporarily fund them. So could the 50K be used toward salaries? No? So a minute ago, you said it could be used for overtime and then something.
Well, that's for running the vaccine clinic. So when we're at a clinic, we're potentially hiring some other folks to work just that day for the clinic.
Okay, so we can't use it for just straightforward
Salary.
salaries. Okay, all
Right.
All
I
right.
was asking whether ARPA could be used that way, but.
Well, we'll get to ARPA. It's a good question. Okay, Chelsea, continue.
Okay, so, and then there's some other grants not related to staffing necessarily, but Heather's done a nice job of bringing like an air sensor grant, and I'm probably not using the right word, Heather, but to the board for us to get, and we were awarded that grant. So we're definitely, even outside of looking at staffing opportunities for funding, we're also looking at ways to improve on other initiatives that would benefit the residents outside of the COVID response. To that note, there's still some uncertainty in terms of what the state allocation or opportunities for grants will be for public health. The Baker ARPA bill has been approved, but it's still kind of funneling down, and it has not been announced on, what avenues are going to be available. It does appear that technology will be included in that. So one of our things that you'll see, one of our initiatives that we'd like to do in our report that we sent over to you is digitization of records, and making sure that we have a solid process and categorization of those on what needs to be housed for lifetime, and then the number of years based on the guidance. So that's definitely something that we would like to pursue in terms of other funding that could become available. I think there's still more to come on the staff, on any funding that would be available for staffing, either at the local level or the regional level.
So you're expecting, correct me if I'm wrong, when you say Baker's ARPA, he and the legislator were in a fight as far as who was going to spend that $5 billion, whatever it was, right? So this is his piece that he got to spend, right? That we're talking about. Okay, so you think there may be funds in his piece that would provide even more money than, for example, the $300,000 a year, similar to that? It could amplify that.
Yeah.
Okay.
Yeah, but it's not clear on what that could be used for. The guidance just hasn't come out yet. So we have CSS engaged on contract. She's the consultant that was hired to help the town with how to spend the $3.1 million. And she is keeping her ear to the ground on what would become available from a public health perspective as things become available, because it's kind of getting broken up into, which agency is going to handle, X amount, for whatever category it is. And so that just hasn't come to a head yet on what exactly is going to be available and who can apply for it, meaning a local or a region.
Okay. All right.
So the other big piece of what the health department does is inspections. So we haven't spent too much time talking about that. And if you notice in the budget line, there's a contracted services line, and that is for a contracted inspector. He's a sanitarian who works about 16 to 18 hours a week for Southborough. Obviously, certain times a year can drive more hours or less. But he essentially does all of our inspections related to Title V's and anything like that. He answers questions on site plan review. He does soil testing. So he really runs that side of the house. And as Kathy had mentioned earlier, the prior public health director, who was part-time, kind of filled in when he wasn't there. So when that gentleman, Paul Pazinski, retired, the Mary Lou and Heather worked on getting a backup for us. So we currently have a backup inspector for when the current contractor, Dennis Costello, is unavailable, out of town. And I think we've used him a few times, Heather.
Just a
when
couple,
Dennis has
just
been
a
out.
teeny, just a little bit. I mean, Dennis
Okay.
can usually keep up even if he's not there for a week, you know,
Yeah.
a little bit.
So that is, I mean, prior to this pandemic, that had been really the focus of the health department. And, you know, as was mentioned earlier, kind of the health side was not. And so, you know, the staff that are here are, you know, probably getting calls related to some of the sanitation stuff. I know our business administrator tries to, you know, triage and field as much as possible. But, you know, Dennis is not present in the health department 24/7, but seems to keep up with, you know, the 16 to 18 hours a week. So that is in our budget. That is not regionalized, although he does work for another town. But that's kind of how that side of the house works.
So let me throw this at everybody before we go. Let's stay on this for a moment. So he gets paid by the hour, right? So he doesn't, if he's working, he's not sitting around, you know, he's gonna, when he's got one to do, he goes to do it, right? And he's 65,000. So it looks like he makes what, $60 an hour or so?
64.
So I'm looking at last year's local revenue as far as what we received, and I think I've got the line item right. Nancy, you remember last year, Mary Lou kept saying several times, made a good point that don't forget, we get fees, we get paid for doing these inspections. So if I'm looking at the right line item, it says health department. So there may be other things that flow through that besides that, but I bet this is a line share. It was $65,000 of revenue last year. So he didn't really cost us anything. It sounds like we, you know, break even. I know, Chelsea, I think in your memo, you said you guys have voted to raise the fees as of
Yep.
1/1/22. So that even goes up, right? So I don't see how we get too excited about that one because the cost is covered by the fees. And then if you've got, you know, even, you know, some more help coming from the shared services grant, it looks like that is almost even a profitable exercise. So I don't think that's the problem with this budget because of the way that one works.
That's the goal, is to get the revenue to offset the expense,
Yep.
you know, for that.
That's good. So how
so-
much did you guys raise it percentage wise?
It wasn't every line item, so we restructured a few things, but we're thinking the net is probably 20,000 more,
Yeah, we're good.
but for a year. 15 to 20.
That's good. So
Adding a few things that we never charged. And we compared probably to like 5 other similar towns. And, you know, so we're hopeful that will help a little bit.
what did you do once you compared? How did you come up with what you chose?
So there were some that we were the lowest on. So we went to, you know, we went above midpoint on all of them, at least. And we, you know, we just picked what we thought was reasonable for, you know, the amount of time that, you know, Dennis is spending and, you know, anybody else that kind of gets involved in that piece. So we tried to essentially match up the time with the cost. But obviously things are, you know, can run longer or shorter, but we tried to take the average.
And the revenue doesn't show in this budget. This is just the cost. You see the cost side, you don't see the revenue side. So I just wanted to make sure we knew there is a big revenue side to
Mhm.
this. If Mary Lou were here tonight, she would make sure that we knew this. So I am invoking Mary Lou as far as that goes. Okay, keep going.
So you mentioned the printer copier that was acquired in this this fiscal year. That cost for next year. So we did end up leasing it. And that cost is reflected in the IT budget. So that is not in here. So that's going to be 3,000 for this year. So I did double check with Jay to make sure he had that in there. And then nothing other than the salaries, nothing else changed in terms of the kind of below the salary lines for expenses. So that kind of covers the summary report that was submitted to you. The longer report is kind of an overview, but has a lot of detail in it related to what the town of Southborough will gain in terms of service and initiatives if these two positions were fully funded. So Taylor and Heather spent a large amount of time kind of going through what they currently are doing. And when I say currently doing, that means like when they're not spending 70 hours a week doing contact tracing. But in, non-surge time, I guess I'll say, which would be kind of July till kind of October, maybe, what we're doing on an ongoing basis. And then they went through what they think the opportunities are for the department, and really thinking of, what things could we accomplish for the residents that would be beneficial from a public health perspective. So some of them are, if we don't get to, it's not the end of the world. So those are really the low priority things that could get pushed out. The high priority things are things that we feel like need to be done sooner rather than later. And then the medium priorities are items that we really would like to get to in the next 12 to 18 months. So that's to kind of give you an objective feel for what the opportunities are for this department. So I don't know if everybody kind of dove into the details and has any specific questions about those initiatives, or if Heather or Taylor want to speak to anything specific that they want to touch on. I mean, I'm happy to go through all of them if you like, or if you feel like you had enough time to absorb them, however you want to do it.
Let's see what everyone says. I prefer not to go into the details because, again, I don't think it's our job to do this. Our job is to, recommend a budget, right? And we don't have the expertise to question whether you should be doing a substance abuse prevention program. It also, clearly a lot of time we spend on this, no doubt about it. We could say things like, are you working with Youth and Family Services on the mental health piece of this? Because they certainly are focused on it. And, are we making sure we are collaborating and not siloing this? But again, I don't think tonight we should get into that kind of weeds, and anybody advisor can disagree with me. You can ask anything you want to, but we'll be here all night if we start going through these one at a time. So I think we've got to focus on the big picture, which is whether we're going to be able to recommend a budget that makes these positions, full-time and permanent. And it's a 53% increase in the budget year over year. So that's where I think we've got to focus tonight, Chelsea. And then I do think we'll be meeting again before we get to town meeting as far as really trying to finalize this. So I think tonight we stay on the big picture as far as, is this the permanent structure that we think we need to have in this town? Can we get to that conclusion tonight? Probably not, but we've got to at least try to gather as much information as we can tonight. So I'd like to, give Dr. Medina a chance to talk, Heather, Taylor, Nancy, if you guys want to say anything after this, please raise your hand and say, yes, I'd like to say something. And then once we've gotten to that, we'll just go around to the individual advisor members and let them ask what they want to ask.
And the reason why we put that report together, Kathy, is in response to advisory last year saying, I don't understand what we're going to get by fully funding these two positions. So that was the genesis behind kind of putting all of that detail in there so that you would understand what the department, that there is a plan and this is what the department is looking to do. And I completely understand your perspective on it. I just wanted to make sure that you had all the facts.
So totally helpful. And I continue, and I think others do continue to hear how hard and what good work both Taylor and Heather are doing. So I want you two to know that. That's not a question as far as that goes. This question is this the right structure? Because you look around at other towns, they don't have the structure. You look at what other towns spend per capita, it's a lot less than what we're proposing to spend. So, what do they, why do they look at it so differently than we are? So we're just trying to get, educated so we can make an educated, informed decision here that is the best for the town of Southborough. Okay, I've talked enough. Dr. Medina, do you want to say anything else at this point?
So I think your first question is, what are we looking at in a post-COVID world? I think that's sort of the essence of this as we look to the future. And are we really going to have a post-COVID world? This is going to become likely an endemic illness that may have surges that may need us ready to deploy, and it may not be the only potential infectious agent that may cause this level of illness. So I think in terms of preparedness, we saw when we weren't prepared how difficult that can be. So I think having a structure in place is extremely important. The second part of this is that when you look at what people in town need, and Taylor had done a survey, I think, and Heather and Taylor had looked at the analysis, and if you take COVID away, people's top priorities are their mental health, the effects of climate on their health. People are concerned about health equity, and these are all things that fall within the realm of a good public health department. And these are things that need the expertise that Heather can provide with both medical knowledge and public health knowledge, work in disease prevention. And then, when you have the expertise of Taylor to implement a lot of these things, and we've seen the success of our vaccination clinics as the perfect example of something like this that can continue. It does not have to necessarily be a COVID-19 vaccine. We can look at other vaccinations and other public health measures that can be done for our town. And in terms of other departments, this is all very collaborative. I think public health needs to work with youth and family services as looking at mental illness as a disease prevention model. Public health needs to work with public safety to be ready as far as disaster preparedness goes. So that is what we're looking at. And when I look at how we, look at the region, I see Heather and Taylor looking at our interests. Now we can share services with the region as we are, and, but ultimately the needs that are specific to our town using those shared services, we need that expertise in our town. So I don't know if anyone has any questions about what I said. Again, a brief summary. I didn't go into a lot of specific details, and I think this is also in line with what the state has put out for public health goals.
So the state doesn't have a model town health department yet, right? There's no white paper out saying this is what a 10,000 person town health department should look like. We're nowhere near that yet, right?
Right. I think what the state has is goals, set public health goals that we should meet. I think that's what I think we're referring to as the goals that we should meet.
There was the blueprint, right, in 2019. That was sort of a roadmap about bringing local public health up to a higher standard. And so it didn't have specific about town sizes, but it did discuss about the majority of towns not being meeting basic requirements, not having trained staff, et cetera.
One would think, Harvard or someone who's got, a humongous health department would do this research and say, this is what it should look like. This is when you regionalize, this is when it makes sense. This is when there's economies of scale. And this is when you really need to kind of do your own thing. I mean, one thing that's different about Southborough than the other three towns is our reliance on septic systems, right? The other three towns don't. So that's one case where
Boylston septic and Northborough's at least have septic.
But no one is as reliant as we are, Heather. So that's one case where we actually are different than the other three, right? Substantially different. So there may be other cases where we really are different, and therefore the shared regional approach doesn't make sense. But I don't know what they are. I wish somebody would do this and put us out of our misery and explain all this. Okay, so thank you, Dr. Medina, for that. Taylor, do you and Heather, do you guys want to add anything before we go around the room? Nancy?
Well, I just wanted to add to what Dr. Medina said. It was at a few of the clinics, and I know people really appreciated being able to get their vaccinations in their hometown versus going to Patriot Place, or some had talked about having to go way out in Western Mass. And, some people don't, that's a hardship for them to have to go to these places. And I don't think you get the same vaccination rate when it's difficult to, get to these places. So I just wanted to, I pretty much echo everything Dr. Medina said, and just wanted to add that the townspeople seem very happy to have, resources in the town available to them. So.
I mean,
Heather?
I guess just a global concept that, public health and the health department is a service to the town. So, we respond to, in priority wise, the particular, situation that's going on. So it's a little bit hard to look at, well, in 3 years or in 5 years, you want staff that covers a, wide range of expertise, but there's not, Chelsea had mentioned, to look at the hours, and I track them as well. So Carla has all those timesheets. But for the past, even when, even in the summer, when wasn't much, weren't very many cases, it was still, for me, basically 50% time was on COVID. So in the fall higher, and obviously in January, a lot higher. But so even with the cases being down, it still is touching upon most of the meetings and plannings and things that we're doing in our interaction. We interact with the state every week. We interact with the schools every week. And, sometimes the meetings can touch upon some other things, but it's still, even in low times of case count, we're still spending, since I've been here, way over half of time on COVID. So it's a little bit hard to think about the responses. But 2 years ago, when the state looked at local public health, that was before COVID, and they really noted the deficiencies in most health departments. And I think that with COVID, like Dr. Medina said, there may be other infectious disease that's only going to be increasing. But also, I mean, with COVID, there's less potential, I think, statewide regulations, but local schools and businesses are then sort of on their own with our help, working on making their own, for each business or each school, they're making their protocols. So we're involved with that. So we're involved with that even when cases aren't high. And then, potentially with, mental health impacts, post-COVID and during this time are increasing. Youth and Family Service, we definitely work with. They did a survey that noted an increased need for mental health services. So that's a little bit that the department, health department's going to kind of respond to different, a wide range of topics, I guess. COVID is touching upon most of what we do right now. But there will be, it's a little bit hard to predict, what's going to be a huge topic 6 months from now or 2 years from now.
Yes, it is. Yes, it is. Okay, so Taylor, you want to add anything too?
Sure. Thanks for having us here tonight, everyone. So I don't know if, I probably have talked to a few of you at this point, but I took this job because I was at the hospital and starting to get burned out because of COVID, and I'm also a resident of Southborough. And I was really looking forward to learning more about the town and also doing a lot of outreach. And I still am looking forward to doing that. I think there's a lot of potential for a lot of education gaps in public health for this town. And I think that we have a lot of stuff that we can do in this town that hasn't been touched upon as far as education. And I am hopeful that we will be able to do that.
Thank you very much. Okay, so I'm going to turn to Andrew Pfaff first because he's done some work that we want to share with you as far as, it's hard to do. So, you may end up comparing apples to oranges, but we did take a look at surrounding towns as far as what they spend on this type of service. So Andrew, you want to pop it up as far as the spreadsheet goes?
Sure.
And lead that discussion.
Yeah, let me just,
So he had to combine the cost of 4 different departments to get to a number that looked like it was comparable, which he'll explain.
hold on a second. All right, let me know if you can see my screen.
Yes.
So basically, this is from 2021 numbers from Department of Labor and Statistics, or Division of Local Services, right? The state. And this is kind of some of our surrounding towns. And this is the cost for human services, which includes, for us, would include Council on Aging, Youth and Family Services, and Board of Health. And just kind of like what the per capita costs. So as of, FY21, that section of cost was a little bit higher than our peers. The state average is about $49 per person per year. We were at 72. With the new Board of Health budget and the other new budgets, we'd be about 95. So again, we're up in the upper echelon of our peers, and we'd be in the top 15 of the state. And I started to look a little bit at Wayland and Acton, which are closer to, the amount. Wayland, I believe, includes the school nurses in the Board of Health, and Acton has a home health agency with about 7 employees where they, they'll actually do Medicare, treatments in people's houses and occupational therapy. So, just based on the numbers, right? I think the question is, are we getting the right bang for the buck in terms of our size of a town, right? Are we over, is the cost higher? We're a relatively small town, 10,000 people, roughly the size of Wayland, but there's a lot more coming in that number. So that was my first analysis there. But I'll just pause that share. And then and we don't currently have any per diem nurses, right? So it's just
We do, but they're not in the budget.
they're not in the budget. Okay.
Right, that they're just basically did a little with the CARES and FEMA.
Okay.
COVID specific.
Yeah. So basically, for our budget, we have basically around 2.4 FTEs, and Acton, for instance, has 6.8. So that was just one. So again,
So 6.8, not including the home health.
no, that includes the home
employees?
health.
Okay.
There's another 2.2 employees that aren't funded by the general fund. I think they're paid out of, I don't know, reimbursements or something. So they have, 9 employees in total. But I think they also, it's a weird setup in Acton. They also help Stowe and I think some other towns. But it's just I was curious to see why their costs were similar to ours and kind of looking at their model. And they have a Board of Health, which has a land use director that does like septic inspections. And then they have a nursing services, which is like a separate kind of bucket. But so it's just one of those, like kind of looking at Wayland, kind of looking at Acton, which were similar in terms of per capita cost, what are they getting for their money? It's a little bit different, I think, than the model that we're proposing. So I think that's the only the only thing to me is the cost per capita stuck out as being, higher than our peers and, almost double that of the state average. Again, that's
It doesn't mean we're wrong, but it does give you pause when you see that kind of spreadsheet, that we're so different than all of our neighbors, as far as the cost per person. So let me ask you guys this: what does Northborough have right now as far as Board of Health, Department of Health, as far as employees go?
So they have, what's funded in their budget is 2.175 FTEs. And then that's what they have funded in their budget.
And what are those people? What are their roles? What is their?
There's a full-time health a full-time health agent, although a small portion of the grant goes
Right.
towards
Her
her
salary.
administration time of the grant. So it's not a large amount, right, Heather?
Right. Yeah,
Um,
and then,
but
but
that is offset.
Diane is now hired 16 hours per week just by Northborough, and then I believe the
Yeah.
other hours are hired by the greater boroughs.
Right,
That's the-
so they have a point
He's also a health
1.7.
agent, right?
Yeah. So that the inspector, whose title is a health agent, is 0.175 in the Northborough budget, and then the difference is from the grant. Is that right, Heather?
I think she's up to 16 hours by Northborough, which is a little more than 0.16.
Okay,
But
So 0.4.
months ago, she was 8 hours for Northborough. Now she's 16 hours for Northborough, and because she does so much with clinic.
Right.
Anyway, my understanding, she's 16 hours. They have a 40-hour health agent, which some of the salary is now covered for by the shared service grant. And then they have 2 admin, but each is part-time. So I don't.
Okay,
they're
so
about
hold on, this is getting
4
confusing.
hours.
You get the shared services grant for a moment. If they didn't have that, what would they have as far as staff goes?
they would have one 2.4.
Yeah, but right, but Diane, they would have 16 hours. They raised her.
Yeah, so she'd be 0.4.
Right, and agent is 1, and then the 2 admins equal 1
One.
position is basically
So
the
they would
20
have
hours.
1 full-time agent, 2 admins that added up to FTE. So that's 2,
Yeah.
and then what makes up the rest of it?
0.4.
16 hours.
Okay, and what does the point?
So
4 person
0.4.
do? What does that person do?
Agent.
She's
health
the
agent.
food and housing. Sorry, Heather.
Okay, she's the one that's coming to Southborough to
Yeah.
get our restaurants. Right. Okay, so the
And they do
full-time,
contracted nursing, right? They do contracted nursing.
They have $7,000 a year in contracted nursing. That's just part of their budget.
okay, so we understand admin, we understand the inspector that does that. What does the healthcare agent do?
The full-time,
Yes.
she's essentially their health director. So she would do similar functions as Heather, as well as she does do inspections.
She does inspection stuff. Do we know what her salary is?
Roughly, yeah. I think we could find that out.
for which one?
But I think
Kathy?
Diane, that's why they upped her hours. I think at this,
The
right,
health
to do
care-
more inspection, and then the agent director, not as many. Yeah, but
Yes.
Sorry, Kathy, which role were you looking for?
The health agent.
agent. It's not
95,
90.
94.5.
Okay. So that, we share a lot with Northborough. That's why I picked Northborough. We share schools, we were talking about sharing a group health plan. So, we talk to them a lot. So to me, that's the one we ought to compare first. So if you just look at their department, it's quite different than what we're proposing. Again, maybe we're right and they're wrong. Maybe they're right, we're wrong. Maybe there's some combination. So the point we're trying to make tonight is there doesn't appear to be a model to necessarily latch onto. So we've got to do our own homework to try to figure out truly what the structure should look like. So we're not necessarily quibbling with what we should do. We're talking about the structure, about how to do it. Because if you go through that very detailed Word document as far as all the things that you could do if you had the time to do it. The list where you said, high, medium, low. You could definitely make a case that almost each one of those would be prone to regionalization. To me, they look like things that if you did those things for 4 towns, you could probably save a lot of money. There would be a lot of economies of scale to have it done for 4 towns instead of repeating that by 4 different towns. Now, maybe I'm wrong. That's just my initial reaction when I went through those. So that's the kind of thing we've really got to get an answer to before I think at least advisory is ready to recommend, this structure that is in this budget. And until then, maybe what we can do, like we did last year, is find a way to fund this for another year using money that doesn't require real estate taxes. And Chelsea and Tim Martell know where I'm going with that. So we'll talk about that. But this is the kind of thing we've got to have answered. We really got to understand, where the benefits of regionalization are, so that we can start there and then fill in the gaps elsewhere instead of doing it the opposite. Filling it, doing these 2 full time, then saying, whoops, we really should have done it differently, because we're talking about people's lives here and salaries, and they need to know what, they need this surety of what their job looks like. And I appreciate that, both of you on here. I know this has been tough listening to for the last year, and you guys have hung in there. And you definitely grown thick skin, I'm sure, as far as listening to these discussions in the public about your life and your salaries and everything else. But I don't know how else to do this. Okay, so Andrew, you've done that now. Why don't you take it from here as far as your questions go?
Yeah, I mean, I think that was my major. Yeah, so if we look at Northborough, for instance, they have 2.2 or 2.4 FTEs, and that was FY22. But they have 15,000 people, and the cost is 220,000 versus 310 for 10,000 people, right? So those are just one, and we might be getting a lot more, and we might be worth it, right? But I think that's where, as somebody that doesn't know, and I read the report, and all those things sound good, but it's one of those tangible, right? It seems like other communities are doing similar things for cheaper, and that's the only part that kind of stuck out to me.
I have a question, Andrew.
Sure.
Can you put that spreadsheet back up on the share your screen again? I had a question, or I might not have a question once I look at it again.
Sure.
Thanks. So when you are just want to get an idea here. So the numbers that you have in column AI.
Yep.
Every other town you have listed besides row 15 is using their 2021 numbers as the denominator.
So I have Southborough in here twice, right? So the same.
Yeah.
This is with the 2023 estimated number.
But I mean, we have to assume that
other towns have gone up. Yeah.
Significant, right? I mean, given what people were budgeting for fiscal year 2021 compared to now, given what's happened in the world of health, like we don't know what those towns, some town could be the same, some town it could go up by
correct
factor. Okay.
Yeah. So I mean, it was just kind of, let's see where we stacked at that point in time, and then just kind of ran it, and that's why I left a separate line for that. And then and this was kind of the other piece I was looking at, right? So was our 2021, right? We were at 17.5 for, this is just Board of Health, compared to what Acton was doing, and then here's Northborough. So it's just, those are more targeted just at the Board of Health, because again, this number in here includes Council on Aging and Youth and Family Services. So it's not a really accurate number. It's just more to dig into it and say, hey, we're closer to this town versus that town. Let me dig in and see where it was. So it helps a little bit, right? But they don't track as a state level, the Board of Health, nursing at an individual line item in the data. You have to go to like the town budgets, and it's a little bit harder to find.
Okay.
And also fiscal year 21 for Southborough is our old structure where, Paul Pazinski was the director part-time. So it is, it looks a lot different today for fiscal year 22 for sure. And then of course, fiscal year 23 is basically the same structure as 22, but it's being put in the budget for the first time. So it may not be apples to apples, but that's the best we can do as far as really trying to understand what other towns are doing with this kind of department.
Taylor, you got your hand ready. Go ahead.
Yeah, I just had a question about the budget. Does that include our contractors line item?
The 310 number that I was showing there.
Yeah.
It does include, it includes the contracted services as well. Yeah. The 64.
Okay, and then we essentially cancel him out and then maybe plus some.
Correct. Yeah.
Okay.
But again, the revenue is, I don't know if I don't think other towns are putting I'm sure it's going into their local receipts. I don't think they're adding it into their Board of Health budget. Right.
Right. No, I was just curious. Thank you.
Of course. And again, you guys do phenomenal work. I'm not saying anything about that. It's just one of those things that stuck out of me. I did the same thing for police, fire, schools, recreation, kind of looking at it per capita. And the Board of Health was just one that we ended up being in the top 20 in the state versus kind of in the middle of the pack. That's all I got, Kathy.
All right, thank you. Adam?
Yeah. Good evening, everyone. Thanks for the presentation. And Chelsea, thank you for walking me through the budget in advance as well. This is a really tough one for me. I don't want to rehash all of the things that Kathy already went through, and Andrew, that analysis that you put up there is really helpful. I will say, even before Andrew shared that, just based on my review of the structure, and I'm fairly new to advisory, but based on the structure and all the programs that you outlined, I was a little confused about whether it was the right structure. I know we're not necessarily here to nitpick in terms of some of the specific projects and priorities that the Board of Health has in the summaries, but it did seem to me like a lot of what you're interested in, which is really important when we talk about disease control and environment and mental health, and all the topics are really important, but it did seem like it was unclear what the benefit or incremental impact to the town was based on this new restructuring. And a lot of the projects seem like they could be reinventing the wheel. There could be things that neighboring towns are already doing and to meet the needs of the town in similar ways that we're attempting to or desire to with some of those future projects. I also definitely don't want to make this about COVID specifically, but I think it's very hard for us to project how COVID's going to evolve our needs. And I'm not sure, just based on what's in the summary document, if I personally agree with everything that we're projecting as far as the needs go on COVID. I'm not sure how the town would perceive that either. Obviously, that starts to get into politics, which I'm not trying to make a political statement there. I'm just trying to look at the facts and the science of it. But I think if we rely too much on COVID to try to push this structure, I could see that kind of going down a death spiral, as we know that can be a polarizing topic sometimes. So I'm honestly just confused and unsure of what we get out of this new restructure. When you look at the budget, if I include the contracted services in there, which I know it's not an employee, but it's essentially comparable to.
Are you looking at something, Adam?
Yeah, why don't we pop it up, Andrew? I can do it if you want me to. I've got it right here.
Okay.
All right, let me.
Sorry, I know there were no real questions in there, but I'm just sort of speaking my mind on it a little bit.
So Andrew, it says you disabled me.
I just made you co-host,
Okay.
so you should be able to present.
Can everybody see the spreadsheet?
It's a little scrunched. We can see it, but
Yeah, make it full, try making it full screen there, Kathy. Yeah, there you go.
Yeah.
That's good. Yeah, just scroll up a little bit.
yeah. So when you look at the budget, if you removed the salaries if you didn't touch the structure, the budget itself, as you can see, there's lots of zeros in there. And so if you kind of apply just, let's say, a 3% increase to the way it used to be, the whole budget only goes up 2%. So really what we're talking about here is your contracted services and your salaries, which represents 98% of the budget. And when we think about all the programs and projects that you want to do, I also have a hard time believing, unless it's all covered by grant money, that you can accomplish that just with more time. And so it does seem to me like there's a disconnect, again, unless it's all covered by grant money, that you could actually do all the things that you want to do just with this restructuring. It just seems like we would need more funding to accomplish some of those things. So I guess that's a disconnect for me. We walked through when Kathy kind of gave the context in the opening about how a lot of this is moving from 17 hours for Heather to 30 hours and Taylor from 15 to 30. And I guess I just don't know what we're getting for those additional, 13 hours out of Heather and 15 hours of Taylor. So I guess I need help understanding that. And to Kathy's point, maybe it's a subsequent meeting. I don't know, but I'm not sure where to go from there. I guess I maybe rambled a little bit, but that's sort of where I'm at with the budget.
And Adam, Heather's working this year in 22, 30, and Taylor's working 40. It's just the other part's covered by other funding. Right. So it's really.
So this fiscal year 22 budget is very misleading as far as what the real costs are. So everybody needs to understand that. The additional cost of the two ladies is being borne by either CARES Act, FEMA, and or a contingent reserve fund transfer at the end of the year.
Right.
So if you have the real cost in there, there would be very little change from 22 to 23 because they didn't change anything down here, right? That's literally flat to the penny. So if you had here what their real cost is, you probably would see, I don't know what the number here would be, but it'd be what, 2 or 3% or something. So I'm not sure what the change is from fiscal year 22 to 23 as far as their salaries, but we can look at that.
So to that point, though, if we're already kind of working that total number of hours that we're projecting that now we need to pay for, how do we accomplish some of those future projects? Are we just, do you got extra time on your hands? I mean, how are we going to?
I think the projects are, driven by, our staffing. I mean, by our people. We've just signed up for constant contact account to do emails and education, and we do Facebook. We open that, so it's things that we're doing. I don't think there's a lot of other additional costs, but I think when we look back at our hours over the summer, it was 50% of the time was COVID. This fall was 66%. I'm talking about my time was spent on COVID activities, and in January it's 82%. So even I think if it's not going to go away, but if it's down at 50%, that's still going to be more hours to do some of these other topics. And
are they going to have time freed up if COVID dies down to do these other things? It's not like they're not busy full time now. They are.
Right.
There's a lot of COVID in it. So if we can get COVID to dive?
Less. It might, it may just stay at 50%, but this month it's at, almost 90% of our time. Probably 100% of Taylor's time. I still do some other things. So I think it was looking at potentially how we would spend our time. If we were doing less time on COVID, it won't be 10% of our time over the next few years. Anyway, and then, the blueprint that was done by the state looking at health departments and also looking, since I've been here, at things that just are not being met. I mean, there's health standards and regulations that are not being met and are not being met by most local health departments. Looking at, just since I've been here, inspections that were not getting done. I mean, years behind on certain situations here in town, that that was even before COVID, that the state was recommending that we really needed an increase in staffing and services to get kind of the basic regulatory functions and public health departments. There's more and more sort of to public health, I guess, than there were 10 years ago. So, water, air, septic, I mean, there's just a lot of different arenas, and those were not being met in local public health before COVID. And now with folks spending time on that, there's just a lot not being met. So we're working toward that. Maybe, like you said, it's higher than some of the other towns. We are working towards that. But I would still say that there's, look, and that is wonderful to look at combining towns how we can to maximize. But there's a lot sort of things that hadn't been met even before COVID. So, the increase in staffing and helping with shared services, there are basic functions that weren't being met, let alone kind of looking at a broader, improving the health of the population. I did a examination of Southborough when I first got here, our rates, exercise, diet, chronic disease, cancer, higher than one would expect on some of these measures. So there was, that's kind of a higher level than responding to the immediate regulatory functions that are that are just not getting done in local public health in our state.
And just
So
one
Heather, I
other,
think Adam's point is pretty good, though. So hear what he said. You look at this detailed document that talks about things that you'd like to do and prioritize them. There's nothing in the budget to let you do any of these besides the salaries. And constant contact, that costs money. Maybe you're going to say we're going to use the grant for doing that.
Right, we did.
That's fine.
Right.
That's fine.
We did.
Okay, that's
Right.
fine. But these things do cost money. If you look at what Dr. Medina wants to do as far as the tobacco, the program there to promote a program.
Right, but I am working in my time on redoing, policy is so important. So I'm working on doing our tobacco control regulations, like a deep dive into that is just my time.
Okay, all right. But so here we said, I think he's got a good point that some of this may take more money than what's in the budget.
Right.
Okay, Adam, anything else you want to ask before we go on?
No, I think I'm okay. Yeah, I'll
We're
stop
going to
talking.
spend a lot of time talking about this budget, Adam. So we're just trying to get as much.
Those were my high level thoughts. To avoid getting in the weeds on some of the way maybe different programs are prioritized. Those are maybe personal opinions that aren't necessarily advisory's role. So yeah, thank you.
Marcy?
Good evening, everyone. Kathy, I don't know who's sharing the screen. I can't see the folks here for Board of Health, but hello, nice to meet you guys. I am a pharmacist and a director of pharmacy by training. I live and breathe most of what you're doing every day. So I just wanted to commend you guys and also say that like Adam and Andrew before that, I have some questions about the programming and how you would accomplish all those things, with what we have. I think it might very well be that you guys are trying to lead the way instead of follow, which we often say, like, what's the other towns doing instead of what are we doing to kind of lead the pack. So I think I commend you for that. But I think in terms of that write-up, perhaps it would be helpful because we're still trying to put our finger on what exactly is needed if you added real data. And I'll share an example with you. So in healthcare, it's very expensive to add employees in a healthcare setting. And if I have to do that, I have to pitch real data and numbers to convince someone. So for example, if we want to add a pharmacist, I need to show that we did 70,000 vaccines. This was the amount of time that was spent doing that. This is the number, in terms of admin and reporting and how much workload was moved to other people and what does that look like and what's the, basically the quality, safety, value proposition. So I would just give that as a comment. For some of these things, maybe it would be helpful to have that real data because you have a beautiful narrative, but I still don't quite understand what that means in terms of what work was done, if that makes sense. And I think that would help convince people at town meeting or even this group or others, kind of this is what you currently do and this is where you're trying to head. And also I thought Dr. Elker, you made a really great comment, like it might help as well to break it out into sort of foundational practices, like these regulatory and policy things, like what's not getting done now and why is it so important? Because if you say we're going to write policies, I think it's lost on, the average voter or taxpayer. What does that mean? Like what are we missing now that we would benefit from having? So lots of great ideas. I appreciate the work you're doing, but it would be great to see more data.
Thank you, Marcy. Tom?
I'm sorry. I'm good for right now. I've had most of my questions answered. Thank you.
All right. Timothy?
I'm going to hold for now.
All right. Okay. Chelsea, anything else you want to add before?
Yeah. So for the question related to how are you going to fund your initiatives, I think that it would be fiscally responsible for us, knowing that there's a lot of money yet to be allocated for public health, for us to hold off on asking the taxpayers to fund anything right now until we know what we could acquire through grants. And I think and I don't want to speak for the board. So Dr. Medina and Nancy, if you disagree with this, feel free to chime in. But in terms of the technology and the digitizing and kind of getting with the 21st century, that I think would be one of my highest priorities in terms of looking for opportunities to fund through grant opportunities. And I think that could be done in collaboration with either the region or the local level, depending on how that allocation comes down. But I think it's most beneficial for us to kind of prioritize as we're able to kind of lock in funding, and we haven't spent a lot of time talking about that. So again, Nancy and Safdar, if you don't agree with that approach, feel free to chime in. And I think similar to what Heather said, Heather brings a lot of talent in terms of being able to research and understand policy compared to what other towns are doing. She has a lot of networking opportunities kind of in her past experiences. And I think she can do a lot of what is in that document without needing outside funding. So I
have a teaching position at UMass Preventive Medicine and Public Health Division. So I have a number of MPH students and preventive medicine residents I have rotate with us for no money to help implement programs and get some of that work done.
So I understand the comment and the question related to why there's nothing else in the budget. That's kind of the explanation as to why, is because we know that there's going to be funding available, and we just felt like this was a responsible way to go about it. In terms of the hours question, I think the employees who are sitting in front of you today are doing a lot of hours outside of what you're kind of seeing on paper. So just keep that in mind too, as you kind of go through in your head on, what kind of time would be freed up. I mean, Heather's currently contracted for 30 hours, and I don't know if she's seen a week of 30 hours since she's been here. So
Maybe one in the summer, but yeah.
So, there's definitely, there's not a lack of work to be done. I think it's just, obviously they've got to just go with the curve and, respond to what's going on in the community. And I think that the summary document is what we're really hopeful to get to in terms of the high priority. And we just wanted to kind of show what the breadth of opportunities are. And I mean, we can certainly we have the stats, Marcy, that we're happy to share with advisory. The teams put together quarterly reports on kind of categorizing everything that's done. And that's with the current staffing level. So it's, the staff are already doing the work. So it's really not like we're pitching for new, quote unquote, new hours. But we're happy to share kind of the work that's being done in terms of statistics and that. So that was my only comment. Safdar or Nancy, anything else that you want to add?
No, I think that sounds great, Chelsea.
No, I would agree. I think, where we need this expertise to move these projects forward. But again, we can find ways to fund these projects, but we need their expertise in order to get there. And I think, Marcy, you said it beautifully. We can pave the way for other towns. We can pave and be a model.
Okay.
But also, I mean, the kind of the breadth of, having another health department staff with some very rare things come up in public health, an Ebola case, so just things that having a wider breadth of different skill sets here in the department and for their personnel, I think is helpful for kind of the wider breadth that we've had. And in the older model, I don't, maybe Chelsea could say this because it may sound not so great from me, but we did have two heavy focused inspection agents, and inspections were not getting done in a timely fashion. So
Chelsea's made that clear, Heather, that what's being done now is a big step in the right direction, that there's a lot getting done now. So that's great news to hear that as far as restaurants go. Anything else before we say goodnight to Board of Health and Heather and Taylor? All right, so thank you guys for coming. My guess is we're going to see you at least one more time before town meeting. Thank you for everything. We just need to digest everything and then talk about it, and then probably talk to you again about it.
Are you okay with me adjourning the Board of Health meeting then?
Yes.
Okay. So I move that the Board of Health adjourn at 9:07 p.m.
I second the motion and vote aye, Sacco.
I vote aye.
Okay, and Malinowski's aye. Thank you. Have a great night, everyone.
Thank you guys for coming. Thank you very much. Bye-bye.
Thank you.
All right. So we're pretty much done for the night, but let's at least talk a little bit about what we just heard. Tim Martell is on the ARPA committee that's going to decide how the town uses the $3.1 million that's been allocated to Southborough. I have no idea because they haven't gone anywhere yet as far as what they're going to come back with. But one thing that could be done to try to accommodate what the Board of Health wants, which is to keep these ladies on, 30 hours and 40 hours respectively for fiscal year 23, is to use ARPA money to do it. ARPA money was meant, to do COVID stuff. And clearly, you heard it from their mouth, they're still spending a lot of time working on COVID stuff, 60%, 70%. 1 week was 90%. So there still clearly are hours that are COVID related that could be funded by ARPA. So that's all I'm going to say. That's one way to do this, and give them more time to truly sit down with our neighboring towns and try to hammer out some type of regional deal that would take advantage of economies of scale. If you go through each one of these on this document they put together that they clearly spent a lot of time on, this is my personal opinion. I think you can check them off and say, well, if you did this for 4 towns, you'd save a lot of money instead of having 4 towns do this separately. And maybe all 4 towns don't think they need all this, but you could just see, one person doing this for our 4 towns and saving a lot of money and using the grants that are coming their way to do it. The grants may say, if you don't regionalize, you can't use this. So if you're going to do it on your own, good luck. We're not giving you money to do it. The state clearly is promoting regionalization. So I think that's what we as a committee have got to get to is, what we think about, how to go forth the structure and how do we get to a decision on what we think the structure should look like post at least the pandemic. If we're never going to get away from COVID, at least post pandemic where it's not a pandemic and we're just taking a regular booster like we do the flu. And please let us get there,
Yeah, Kathy, and in addition to that, it also just seems like there's within these 4 towns, probably one of them has already created some material very similar and easily leverageable around a lot of these initiatives. So some of them maybe not, where I agree with Marcy, we could kind of get ahead of the pack and lead. But on some of them, I would have a hard time believing content doesn't already exist.
Marcy, what do you think? You are your background is so helpful on several of these things. So what do you think?
Yeah. I think their plan is very ambitious. I look at the timelines and I think, well, this to me looks like a 5 to 10 year plan, and a lot of these things are 6 months. So I commend them for that. You could spend the amount of staff we have on a couple of those, the mental health and the opioid, for example, substance use, that could occupy the same amount of time practically that COVID takes up in my experience. So it's very ambitious. I think it's a starting point, it seems, for the committee there. And I think it's a good one, but there might have to be additional priorities placed on that. And also, I think COVID's not going away anytime soon. We all hope that. But, the next to the 4th dose is coming. So it just seems to never end. So those are my initial thoughts, Kathy. And again, I do think data really drives this. What are you doing? Spelled out clearly versus, what could we get for, X, Y, and Z in clear data, analytic terms, it would really help. And cost avoidance. What's the cost avoidance for some of these things, right? Like, are any of these items costing the town in other ways?
When we met with Youth and Family Services, obviously the opioid crisis is a big thing on their list too, right? And remember, we also suggested to them that they think about trying to use a regional asset for the person who's going to do the clinical evaluation of Sarah, and I think Megan probably has to have it done too. So we already talked about regionalization with them too. And I do want to make sure that they really are not operating in a silo. They're probably not. Chelsea Malinowski is very involved in Youth and Family Services too. So just want to make sure that they really are working together as far as that one for sure. And not going at cross purposes and doing the same thing. So that's important too. So we've got more to talk about. Anybody else want to chime in tonight before we adjourn as far as the Board of Health proposal? This will get pulled at town meeting. So this is how town meeting goes. There's one person that looks at all the budget increases And the ones that look like they're higher than they should be, she holds them. So this will get discussed at town meeting in detail. So there will have to be an explanation of a 53% increase if that's what we debate. I mean, remember, Board of Health is not going to control what goes in the warrant. Board of Selectmen are. And I don't know what they think. You got Chelsea tonight. Chelsea, I think, is going to abstain from voting. Select Board is what I think her plan is. So the other four will decide what they want to see in the printed warrant. And then we'll decide whether we agree with that or not, and whether we want to basically amend it at town meeting. So that's the process as far as this goes.
I would say, let me just show something real quick that I was looking at. I was looking at Wayland. I think it just kind of dovetails with what Marcy was talking about. Like, here's their annual report, right? So the Board of Health talks about what they're doing. You know, I won't go through the whole thing because it's very long. You know, process improvements. Then they go through like inspectional services increasing. They go through different projects they're working on, like food inspections, like the data driven. I think Marcy, this is kind of what you were talking about in here. And then there's even more data down below. But again, like, you know, number of pieces here. Statistics on communicable diseases, permitting statistics, you know, different years, household waste, mosquitoes. I mean, different grants. I mean, I thought this was just a very well written write-up. But
what was the Wayland cost? Was that was a high one?
Wayland was one of the high ones.
Was it the high one?
It was very high. Yeah, it was like 100 and something dollars.
It was the highest, I think.
Yeah, it was the highest for our area. I think it was like 14th in the state. But I believe the school nurses roll into that. But
that's why we got to be careful, you know, to truly try to compare apples to apples. But you know, this blueprint that Heather kept talking about, it's not a blueprint. It's basically a list of mandates. It doesn't tell you how to do it or what the structure should be, you know, like a blueprint would. It tell you how to build something, right? It doesn't do that. It basically lists all the stuff that you should be doing. So it's not very helpful.
Yeah, and it's, I mean, to Kathy, your point earlier, it's a list of stuff you need to do, right? And if you're a town of 100 people, you're still supposed to do it. Then if you're a town of 1 million people, and I think a town of 100 people needs to figure out some way to do it that's, you know, affordable. And I think for a town of our size, it's maybe looking at regionalizing and doing some services or doing certain things a different way. But, you know, that's just kind of where the per capita comes in.
Anybody else want to comment before we say goodnight? Okay, so as far as future meetings, next Wednesday is the school committee meeting. So we're not meeting for anything other than to watch that meeting. So I will post in case we got a quorum. So we'll be legal. Then the next meeting will be the 16th that we actually meet. And then we skip the 23rd and then we're back on March the 2nd. Okay, so it's basically every other week for the next 4 weeks. Okay, so we get a little bit of a break. Okay. All right, any public comment? Kevin or Sam? Nobody's raising their hand. All right, thank you guys for coming. Okay, so motion to adjourn?
Do we do minutes?
Oh, no. Okay, let's just get these minutes out of the way. Sorry, Claire. I skipped them because I didn't want them to have to sit through that. So, yeah, we're going to do the minutes on the 19th. We're not going to do the 26th.
Okay.
Okay, so let's get the 19th out of the way. Okay, sorry about that.
Quick comment if we're not doing the 26th.
Go ahead.
Yeah, Claire. I just noticed real quick that the initials are wrong for Tom. That's all.
Oopsie. For who?
Mr. Wilson.
TW.
Oh, thank you.
Yep.
Okay,
Small
I
thing.
will fix it. Appreciate that.
All right. Okay. Who's got comments on the 19th? AP?
Just small one, Claire, at the very end for adjournment. There wasn't a time.
I realized that after I sent it out. Thank you. I will
No worries.
fix that. Yeah.
I always end up just taking what time we started and how long was the video.
That's what I do too, because I keep forgetting to say, I'll try to do it tonight. You know, if I were thinking, I'd say we're adjourning it. So make me do that. because you do
It's
have,
good
that's how you do
benefit
it, is you have
as
to add on the time that you see on the video to the time you started. So that's how I do it. too. Okay, anything else, Andrew?
That's all I found.
Okay, Adam?
Oh, I am not on mute. That's why. Sorry. No, I don't have anything.
Okay, Marcy?
Only thing I had, I think on line 56, Jay's last name is spelled wrong. I think you might have
Oh,
mojito.
Ooh,
Thank you. It kind of
Right.
switches around a
we're
couple
Freudian,
times.
Freudian
I know
slip.
that.
I have
Exactly.
mental block on
That's what I
spelling that.
thought.
Yeah.
Thank you. I'll
Thanks.
fix it.
Tom?
No, I wasn't at the one on the 19th.
Tim?
Yep, nothing. I'm good.
All right, I got a few, but not many. Okay, so go to 56. Mr. Mojito would like to complete a pen test in PEN. Is that correct, guys? Is that what he said? I don't know what a pen
Yeah.
testing is.
Pen
That's
is,
correct?
it's short for penetration testing.
Yeah, okay, so so that's right, so leave it alone. And I just want to make this clear, Claire, you don't have to add this, but when Matt Probe stated that the initial assessment military was a one-time freebie, that's because the MTC did it, right, Tim? They did the study.
I'm not
The
certain
National
about
Guard
that.
that did it, right?
They were part of it. They definitely were very much part of this.
Yeah. But I
So-
think they involved Jason, right? I think it was a joint effort, wasn't it?
Yeah, but in other words, there wasn't an outside consultant that gave us a freebie. It's MTC did this, or at least
No, it
coordinated
was the-
it and got it done.
But it was the National Guard that did it for free.
Well, okay, that's what I'm asking. National Guard did this?
Yeah.
Hey, okay, I didn't know that, so, okay, so never mind.
So these were, just so that you know, at the last meeting, I had, because there was so much, what I considered intricacies, you know what I mean? With the IT budget, I sent the text to Jay, and he did get back to me at the beginning of this week with,
Okay, perfect. We got it.
Just a
So
couple
in other words, this is Jay's word, so it's correct. Okay, good.
Yeah.
All right, line 62, mid-sentence, Claire, a time frame in mid-March was set to revisit, just get rid of the ED. It's not revisited.
oh, okay.
Revisit, so just a typo. Okay, now this is what Mary Lou Woodford taught me, so I'm going to teach you. It's not HIPPA, it's HIPAA.
Oh, okay, thank you.
Health
All right.
Insurance Portability and Accountability Act. So I kept putting the two P's in there too, and she would correct me every time. So I'm correcting you.
It is HIPAA.
It's yeah, well, it's
so to
two
speak.
A's and not two P's. How about that? And you got it in a
Yeah.
couple places. So
Okay.
all right. Now go to line 122. I just got a question on this one. Mr. Probst feels the town bylaw for the MPC should be changed to include a school technology person as an ex officio member. I thought the bylaw includes a school ex officio member. They just didn't appoint one.
That's right.
Okay. Mr. Cybers is still listening to this. So Sam, raise your hand if you know the answer to this. Involved in that, so maybe he's not listening. So you agree, Andrew? So I don't think, okay, so can you bring over Sam real quick?
Sure.
If you'd be willing to come over.
I'll double check on the board website too.
I'm almost positive in this case, they just didn't appoint someone, but Sam will know. And they should. Is he coming?
Trying to promote him.
Is he protesting?
He might be rejecting my promotion.
Maybe sitting there in his PJs or something. There he is.
Yeah, Sam.
Hey, Sam.
Hey, guys. I'm pretty sure that the school technology person was I believe ex officio, but certainly was on the list originally. And then there was some turnover there, and they really never got traction in terms of that person's participation. So I think that's still being worked on, and the committee has pushed to make that happen, but has not been able to get that position.
Yes, in other words, the bylaw is fine. It's just they
Yeah.
got to get it done.
I think
So in the bylaw, the voting members shall be appointed as follows: 2 by the Board of Selectmen, 2 by the school committee, and 1 by the Library Board of Trustees.
So there you go.
then ex officio.
So it's not even ex officio.
I think by school committee appoints, but they don't have to appoint the school technology person. But I thought they had an ex officio school technology director or something.
It might, regular ex officio non-voting members may be appointed as follows: one by each of the board of selectmen, the school committee, library board of trustees, and the board of health boards.
So school committee appoints 2 voting and 1 ex officio.
Yeah, I think it just doesn't say that it has to be the school technology person.
And
Well, you're not going
originally,
to appoint
that-
someone that's not technology oriented, right? Why would you do
Yeah.
that?
yeah, originally the school people appointed the technology director there, and then for a variety of reasons, that person was not able to attend very regularly.
All right, so they did it. So in other words, the bylaw is fine. They just need to do it.
That's my understanding,
Agree, Sam?
right?
Okay, so Matt may have said that, so leave it there, Claire, if he said it, but maybe he's forgotten that they're all set. They just got to get the school committee to do the appointments.
Okay.
Okay, so you may want to go back and listen to a little piece and make sure that's what he said, because I would think he would know that there's room for them already. They just got to get the school committee to do it. Okay, so that's enough on that one. Line 158. Lori Esposito, former assistant to Mark Purple, not or former assistant instead of assistants.
Oopsie.
Okay, this is a stupid typo. Okay, this is more substantive. 171, 172. I just want to make this clear as far as Mr. Purple's. Okay, so line 172, you start with vacation buyout is in his contract. So just put a period after that. Then say he can carry over up to 5 days or buy back up to 5 days. Then say the cost of the buyback, 5-day buyback, is in his proposed fiscal year 23 budget, because he has tended to do it the last couple of years. So that's why he wants it in there. It's conservative. He may not do it, but at least it's in there. So the conservative thing to do is to put it in there.
Mhm.
Okay. Line 194, Barbara Sperry. Just after you say 2416, put hour split, so it's clear what that 2416 is.
Okay.
And then get rid of that is adjusted as needed, because it's a 24/16 hour split. There's no adjustment to where it goes in the budget.
Oh, okay. I was actually just referencing that sometimes they change it depending on like if health needs more, and then sometimes Paul needs more, but I'll.
Yeah, but that's kind of outside the budget, right? So just
Okay,
leave
all right.
24/16, move on. Okay, that's it.
Gotcha. Okay.
Claire, I saw 2 more that I just wanted to have changed. 67, can you just spell out Microsoft instead of MS?
Okay.
And then 74, just spell out Facebook. I'm just thinking, 20 years from now, when somebody reads these minutes, who knows if that will make any sense to them.
Mm-hmm. Well, good to see that it's not for naught, right?
Exactly.
Meta. All right, anything else before we vote on these? Okay, so Andrew, can you make a motion?
I move that we accept the January 19th minutes as amended.
Second.
Okay, who seconded? Adam?
Adam.
Adam seconded. All right, roll call vote. AP,
Aye.
Adam,
Aye.
Marcy,
Aye.
Tom,
I'll abstain.
okay, Tim,
Aye.
Cook is aye. So Claire, 501.
Thanks, guys.
Okay. All right, now, motion to adjourn.
So moved.
Second.
Okay, Adam seconded. Roll call vote. AP,
Aye.
Adam.
Second. Or aye.
It's late. Marcy,
Aye.
Tom,
Aye.
Timothy,
Aye.
Cook is aye. So 6-0 to adjourn. See everybody.
9:27.
9:27.
All right, there you go.
There you go.
9:27 adjourned. There you go. See how I forgot again.
Thank you, everybody.
So see everybody in 2 weeks, but we will be posted for next week in case you want to join the school committee meeting, which we think is at 6:30.
Cool.